Ductus, the fat lobular, pectoralis muscle, the rib cage, everything as usual. And the equipment that we're using, also the same thing, we're using the MRI breast coil, but this one, the plastic pad, plastic coil plate, will be changed to the biopsy plate. Okay, we need to understand the indication for the MR guided breast biopsy. We already can done it under ultrasound biopsy or the mammogram biopsy. Why we need to do under MRI breast biopsy? It's higher cost, right? It's more expensive, and then we need to make sure all the gadget is not metal, isn't it? So the only one thing is we only able to diagnose the lesion under MRI. So this is the very main point if you want to do it under MR guided breast biopsy. Because we realize in medical, whatever lesion that we detected, if we can early figure out its malignancy or benign, and then we do something treatment, the survival rate for the patient will be higher. So this is the reason, if MRI only detect the lesion, then we will do it MR guided breast biopsy for this patient. So as well as like non-mass enhancement or rapid wash out, wash in enhancement curve, irregular enhancing masses, new enhancing foci in follow-up MRIs. And also another one is implant and post-surgical patient is very hard to define under ultrasound and MRI and mammogram as well. But MRI we able to do it. Some patients they put in silicone or maybe implant or maybe some post-surgical changes, be able to see under MRI. So lesion that is not seen under MRI and ultrasound, okay? So for MRI diagnostic, we are very sensitive to breast cancer, like I showed you just now the 3 graph that we're able to detect everything, right? But in terms of specificity, it's not so, we cannot say that we just see the DCE graph and then we confirm it's a benign or malignancy. We still need to do a biopsy to confirm the diagnosis. This one. Okay, this is MRI breast cancer. We screening using the MRI. You can see very clearly the cancer cell and also the vascularity for the patient. So for the patient preparation, we switch our mind because this one is mainly to do the biopsy. So we are not going to follow the normal MR diagnostic procedure. We will just aim for the lesion only. So for the patient preparation, we are doing the MRI consent form, make sure free from any metallic object, and also we are using the contrast media. So also we will get the contrast media consent, check the patient medical history, allergic to food, asthma, or any other things, some medication. And also we will do it on the menstrual cycle timing, day 5 to day 12 is ideally. No deodorant, powder, lotion at the chest or the armpit region because we don't want any false positive result or maybe taking other things that's unnecessary. This is what we advise the patient. And also explain the whole procedure to the patient because patient might be worried and we want the patient to cooperate with us. So normally I will explain to patient, you need in a prone position and we want you in a comfort position, and also because the breast at the chest region. We want you to relax breathing. No need to hold your breath because some patients they will tend to hold their breath, try to accommodate us. Then after that, the next second it will be like that. Then it will move so too much. Then we are unable to target on the lesion and get the right tissue that we want. Okay? So explaining the whole procedure to the patient, to assurance to the patient is very important. We're not going to force the patient. Patient can eat some light meal, but due to the prone position, might be discomfort if eating too full, right? So I say you can eat, but not too full, okay? And also, patient will buy the paracetamol 1 gram under IV intravenous for the painkiller purpose. what we practice is when we eventually LA is good enough, local anesthesia at the breast is good enough, but we realize patient mostly LA is inadequate. They need another IV paracetamol 1 gram to accommodate together, then okay, for the pain management. And also we were using the lateral biopsy grid, replace the plate that we used for the MI breast just now. At the exam day, we will prepare the nursing sterile set. Everything must be in sterile and patient in a prone position with the breast cord. So a sterile tray, chlorhexidine, sterile glove, gown, LA lidocaine, and then the intravenous paracetamol 1 gram that we're using. And make sure everything, the coil, lateral grid biopsy, fiducial that we're using is either any oil-based tablet will do, because oil-based will be showing in T1 and T2 under MRI. And everything get ready. Then we will make sure our biopsy needle set also get ready. We are using a vacuum assisted core biopsy and MR compatible with the introducer. You can see here. We have the obturator, we have the introducer stylet, and then the sheet and the needle guide, everything is ready. Must be compatible with the MRI. This is a biopsy set that we are using. And then we're going to start our MR guided breast biopsy. So we work as a team. We make sure the vendor is there, the patient is there, my radiologist is there, radiographer is standby, and everyone, then we'll proceed. It takes about 15 to 20 minutes for procedure, then it will be done. Because mainly we just want to put in and get the lesion tissue will do. So this is the protocol that we are using. We just scan a masked face for the axial vibrant flags. Okay, all in axial. Then we can record in the sagittal because it's a 3D images. One plane, after that we follow by the contrast, 10 mils contrast, and then we will scan one more time for the axial vibrant to see the enhancement of the lesion. This one we no need for 6 frame of dynamic because we are not going to do any diagnosis. We just want to see the lesion. Once the lesion is visualized, then we no more scanning for the axial vibrant. If we are unable to view, then we will repeat the axial vibrant sequence until we detected the lesion. Once detected, then we will radiologist will we will calculate the positioning, okay, and put in to do the biopsy. So this is the biopsy grid, lateral grid that we're using. And also we put the fish oil as a fiducial marker. This is very important. MI grid worksheet. We have 2 different worksheets for this. And we need to get the right worksheet. If it's the wrong one, then all the positioning will be all out. So this is a lateral right breast or medial left breast. So this is the worksheet that we're using. And this one is a sagittal and that one is the axial from the patient view. And this is another one for the lateral left breast and also medial right breast. We need to make sure the biopsy breast that we are going to do, if it's the right breast from lateral side, then need to get the lateral right breast. Okay, then this cannot use. If not, all the position will be all out. We cannot get the right tissue that we want. So how we're going to plan? We confirm already the lesion is visible on the contrast enhancement, right? Then we will do the localizer and then the dynamic vibrant sequence, and then we will mark and lock the lesion using our planning software. And then from the axial vibrant, you can see the depth of the lesion, and from the sagittal vibrant, you are able to locate where is exactly the location that we want. This is an example. So from we already know that this is the lesion. This is the lesion that we want, right? So from the lesion itself to the superficial skin is 2 cm. Okay, so this is the depth that we're going to go in to get the lesion cell and send for lab. And this is a fiducial as a marker to have the coordination. So for the axial vibra, we look at the depth. Okay, so from the lesion itself, then we calculate, get the distance from the surface of the skin to the lesion. This is for the depth. And the sagittal vibra is for the coordination. We will lock it over here and then we move the images to the grid, then we're able to calculate on which grid line, which coordination that we want, and then we know exactly which grid that we will go in. This is an example. We put in the fiducia, the F. This is a fiducia as a guideline. We will put the fish oil here, and then after that we calculate it's in the D6 box at the lower corner, right lower corner here. Then we will go back to the image view at the Lego. This is a 1A. After we notify this is 1A and D6, we will go to here. 1A is over here and D6 will be represent this box at the left upper first one. D6 here. This is the location that we're going to set to go in and get the tissue sample. So after that, radiologists get the exact location and the depth is 2 cm. Then we will set in using the needle to poke in with 2 cm. And then before we get the biopsy cell, we will put in the obturator first to make sure that's the position, exact location of the lesion before we do the biopsy. Okay. So this is the one. We put in the obturator, we reach the lesion that we want. So we confirm, this is the accurate one. This is what we want, confirm already. Then the next step, radiologists will directly do biopsy on the region. Okay, then do the biopsy. That one, it depends on radiologist. Either one to 360 degree, or maybe 12 o'clock to 3 o'clock, or maybe 3 o'clock to 9 o'clock, depends on the lesion region. Okay, and right after the biopsy done, some patient will have a hematoma. The white one is bleeding in within the lesion itself. Okay, after the biopsy done, because it's hematoma inside, so radiologists will do the wet lavage and also dry lavage. Which wet lavage is we put in some saline to clean up the region that we taken the biopsy tissue, clean up, and also we collect it. After that, dry lavage is to vacuum it. We suck out all the air and also the blood inside to close up the cavity, okay? To close cavity, clean up and vacuum all that, okay? Once done, radiologists will put in a marker to mark that this is the MR guided breast biopsy that we done, because it will be visualized under the mammogram. When the patient go for a mammogram, we able to visible the marker there. We put in the marker and then follow up by the gel form to close up. And then this one, my radiologist also share that we must put in the marker first, then only followed by the gel form. We cannot put in the gel form first because it might be dispersed the marker to other place. So we put in marker first and then we put in the gel form. And done. Okay? We make sure the biopsy breast tissue will be sent to the lab. Okay? And also right after that, we will compress the breast to stop bleeding, and also we give a patient paracetamol or any painkiller. If patient pain, take. If no pain, no need to take. Some patients, they are quite doing well, they do not need any painkiller. Some, they are quite sensitive to pain, then they will take painkiller. And then we give MC for 3 days for patient to take some leave. And then within 2 weeks time, we will advise the patient if it's the right breast, then I will advise the patient do not weightlifting to carry babies or doing some hardcore to avoid any hematoma or bleeding inside that we unknown. If patient having any problem with maybe fever or pain or anything, just go to NE directly and inform their MR-guided breast biopsy done, and also can give me a call. And all the MR images, it will be sent to our PACS for saving and also checking for radiologists and doctor review purpose. Okay, that's all for the MR-guided breast biopsy. Hope that it will be beneficial to every one of you. Thank you.